Trepanation. More than 7,000 years ago, someone picked up a sharpened stone and cut a hole into the skull of a living person, and that person survived. It's the oldest documented surgery in human history. More than 1,500 drilled skulls have been found across every inhabited continent. The procedure removed a disc of bone by scraping or grooving the top of the skull with a sharp stone, exposing the membrane that protects the brain without cutting into the nerve tissue, usually to relieve pressure after blows to the head from clubs and slings in combat. The proof of survival is right there in the edges. When the bone grows back and heals over, it's a sign the patient lived for months or years after the operation. In the Inca Empire, between 1400 and 1500 AD, the survival rate reached an astonishing 75 to 83%. 4 centuries later, during the American Civil War, skull surgeries still killed somewhere between 46 and 56% of patients. The Incas, operating with stone, were better than the doctors with scalpels and saws. Some skulls show multiple openings already healed over, proof of people operated on again and again over a lifetime, and a few were even sealed with gold plates. Today, the same logic survives in the craniotomy and in burr-hole trepanation, when neurosurgeons drill small openings to drain blood and ease the pressure inside the skull. Tooth extraction. Before anesthesia, pulling a tooth was one of the most dreaded ordeals in all of medicine, performed by barber surgeons who twisted the bone until it tore out by the root. The medieval tool was called the pelican, and in the 1700s came the dental key, levers that clamped onto the crown of the tooth and rotated until it ripped free, often fracturing the jaw and snapping the neighboring teeth in the process. There was no control over the root and none over the pain, just brute force, a claw planted on the tooth and a hard twist. The turning point came in 1844, when an American dentist named Horace Wells watched a demonstration of laughing gas, noticed that an injured volunteer felt no pain, and the very next day had his own tooth pulled under nitrous oxide without feeling a thing. It was the birth of dental anesthesia, but Wells's story ended in tragedy. In 1845, he tried to repeat the demonstration in front of a room full of doctors in Boston. The patient cried out in pain, and he was driven off the stage to shouts of fraud. Humiliated, he sank into experiments with chloroform, grew addicted, was arrested in 1848, and took his own life that same year, at the age of 33. Today, extraction is one of the most commonly performed surgical procedures in the world, painless and done in a few minutes in a dentist's chair. Tonsillectomy. In the 1st century, a Roman physician would tear out inflamed tonsils using nothing but his own fingernail. The man was Aulus Cornelius Celsus, and in his medical encyclopedia he described how to separate the tonsil from the surrounding tissue and pry it loose with the tip of a nail, then rinse the throat with vinegar afterward to stop the bleeding. The logic was mechanical and direct. Loosen the mass and pull it out, since forceps fine enough for the job simply didn't exist. For nearly 2,000 years, the procedure swung between strangling the tonsil with a tight loop until it died off and cutting it out cold, always bloody and always without anesthesia. Children were the biggest victims, pinned down and held still while the throat was opened. The detail that sends a chill is technical. Celsus's method, based on peeling the tonsil away along the natural plane that separates it from neighboring tissue, anticipated by almost 2,000 years the principle of dissection along anatomical planes that modern surgeons still follow today, only with an electric scalpel instead of a nail. Today, the tonsillectomy is one of the most common pediatric surgeries on the planet, done as an outpatient procedure under general anesthesia, with the child fast asleep from start to finish and home the same day. Cataract couching. The cataract operation already had a fixed price list almost 4,000 years ago. The Code of Hammurabi, around 1750 BC, charged 10 pieces of silver to operate on the eye of a nobleman and only 2 for a slave. Also described in the Indian treatise Sushruta Samhita, around 600 BC, the technique called couching involved driving a needle into the eye and pushing the clouded lens down toward the back, shoving it out of the line of sight. The problem was that it didn't remove the cataract at all. It only displaced it into the globe of the eye. The patient regained some sense of light, but the frequent price was glaucoma, infection, retinal detachment, and very often total permanent blindness. The revolution came in 1967, when ophthalmologist Charles Kellman invented phacoemulsification, an ultrasound device that breaks the lens into tiny fragments, suctions them out through an incision smaller than 3 millimeters, and replaces them with an artificial lens dropped into place. The result completely flipped the old logic. Today, cataract surgery is the most commonly performed operation in the world, with 28 to 30 million procedures a year and a success rate above 98%, giving sight back to people who were blind in under 15 minutes per eye. Perineal lithotomy. In 1658, the famous English diarist Samuel Pepys had a stone the size of a tennis ball ripped out of his bladder, with no anesthesia, held down by strong men while the surgeon cut into the area between his legs. The method was brutal and always followed the same steps. Push a metal probe up the urethra to locate the stone, slice open the perineum, cut into the bladder, and yank the stone out with forceps through the open wound. The only possible mercy was speed. The English surgeon William Cheselden recorded operations done in 54 seconds, and the Frenchman known as Frère Jacques was said to have operated on 20 patients in a single hour in Paris. Those who survived were often left with a fistula, uncontrollable bleeding, urinary incontinence, or impotence for the rest of their lives. Pepys got lucky. He survived, though it left him sterile, and he was so grateful to be alive that he kept the extracted stone in a box and celebrated the anniversary of the operation every single year with a commemorative dinner. Today, nobody has to go through any of that. Lithotripsy uses laser or ultrasound waves to pulverize the stones into fine sand, with no cut at all, and the patient passes the fragments naturally in their urine and goes home the same day. Pre-anesthetic amputation. Robert Liston could take a patient's leg off, from the first slice of the scalpel to the last stitch, in 25 to 28 seconds. Nicknamed the fastest knife in the West End of London, he would clamp the artery with one hand to hold back the blood while he sawed through the bone with the other, all at a speed that bordered on impossible. And that haste wasn't showing off. Without anesthesia, every extra second was pure agony, and patients died of shock or of infection afterward. The slower surgeons lost 1 in every 4 patients they operated on. Liston lost only 1 in 10. On December 21, 1846, he was the one who performed the first surgery in Europe under ether anesthesia, amputating a leg while the patient slept, putting an end once and for all to the age of torment. A famous legend claims Liston once performed an amputation with a 300% mortality rate, killing the patient, an assistant who lost his fingers, and a spectator who supposedly died of fright. The story still circulates everywhere to this day, but no reliable record from the period confirms it ever actually happened, probably just medical folklore too good to be true. Vesicovaginal fistula repair. Between 1845 and 1849, in the state of Alabama, the physician James Marion Sims operated repeatedly on enslaved women with no anesthesia at all, even though ether already existed and was available at the time. The target of the surgeries was the vesicovaginal fistula, an abnormal opening that forms between the bladder and the vagina after long obstructed labor, leaving a woman leaking urine uncontrollably for the rest of her life, a devastating and socially isolating injury. Sims was searching for a way to stitch that hole closed, and to do it he subjected enslaved black women to dozens of experimental operations. Anarcha, one of only 3 named in his writings, endured around 30 surgeries before the repair finally held in 1849 with a stitch made of silver wire. The method rested on the racist, false, and widely held belief of that era that black people felt less pain, a justification used to deny them the anesthesia that white patients received. The result is one of the darkest paradoxes in medicine. The technique that founded modern gynecology, and that today is a routine, painless, safe repair, was born out of a deliberate absence of mercy and out of the bodies of women who were never able to consent. Statues raised in Sims's honor were taken down from public spaces decades later as this history came to light. Cesarean section. In the first half of the 19th century, performing a cesarean was very nearly signing the mother's death warrant. The mortality recorded at the time hovered around 75%, and some accounts put the death rate anywhere from 52 to 100%. It was so dangerous that many doctors preferred to sacrifice the baby rather than risk the mother, resorting to a technique of extracting the fetus in pieces to try to spare her. 2 things killed almost every patient: hemorrhage, the bleeding that wouldn't stop, and sepsis, the runaway infection that spread through the whole body. The fear of the uterus was so great that, after taking out the baby, surgeons would simply leave the cut in the uterus open, without stitching it, hoping the muscle itself would contract and stop the bleeding on its own. The picture only turned around at the end of the 19th century, with 3 advances arriving almost at once: antisepsis, which killed the germs, anesthesia, which took away the pain, and the habit of suturing the uterus stitch by stitch after delivery. The combination transformed the deadliest operation in obstetrics into one of the safest. Today, the cesarean accounts for roughly 1 in 3 births in the United States, and in some parts of the world, it reaches as high as 4 out of every 5 babies born. From skulls drilled with stone to wombs sewn shut stitch by stitch, every one of these ordeals became routine thanks to anesthesia, antisepsis, and centuries of spilled blood. If this catalog held you, subscribe to the channel and tell me in the comments which procedure made your skin crawl the most.